Well, hello. It's Bruce Williams again, and today let's do Growth Path Challenge 44. We're going to do it in the multiple choice format that's favored by the American College of Veterinary Pathologists. And while you're getting ready, take this exam. I am going to thank all my friends and colleagues, as I do at the beginning of all of these lectures and challenges, who have given me such fantastic images over the years, which allow me to put them together. And let's start question number 1. This is tissue from an ox. The gross picture is from the John King Show and Tell website, also in Noah's Archive. The histologic image is from the Wednesday slide conference. The question is, similar lesions are often seen in which other organ? Your selections are A, liver, B, lung, C, heart, or D, brainstem. I'll be back in just a moment with the correct answer. Okay, time's up. We are looking at the kidney of a cow. It's obviously very swollen. There are white nodules throughout. And just to make sure you got to the right disease, because I think I probably would have to consider the possibility of lymphoma, I gave you a nice histologic image of granulomatous inflammation with the arrows pointing at some nice multinucleated giant cell macrophages. It's a classic lesion associated with intoxication by Visia villosa, or hairy vetch toxicity. The toxicity is not absolutely known, but it appears to cause a type 4 hypersensitivity, hence the granulomatous inflammation, which is seen in multiple organs. And the other organ which is almost always involved is answer number C, heart. You can occasionally see it in lymph nodes. You can certainly see it in lymph nodes. Choice I gave you was liver, not so much. Rarely could you see it there. B, lung, don't think I've ever seen it there. And D, brainstem. I throw in brainstem because you can think about listeria in the brainstem of cattle, but not that much else will happen there. So, hairy vetch toxicosis, granulomatous inflammation in multiple organs in cattle. A similar lesion is also seen in citrus pulp toxicity and isobutane ingestion, because the seeds of vetch contain cyanogenic glycosides. You can occasionally see acute deaths with neurologic disease, but this is the chronic presentation of hairy vetch toxicosis. Let's move on to slide number 2, which is tissue from a sheep from the University of Zaragoza. And the question is, what is the most likely diagnosis? Your choices are A, pulmonary adenocarcinoma, B, pulmonary mulleriasis or mullerius capillaris infection, C, ovine progressive pneumonia, or D, mycoplasmal pneumonia. Okay, time's up. Here's characteristics of this particular image. One, we have a large single nodule within the lung. The lung around it seems to have a lot of edema fluid. And if you were there with this lung and you picked it up off the photo glass, you would see a lot of fluid will come out of the lung. And that's the big problem with photographing this particular entity, because as soon as you get everything cleaned up, you put the lung down, a lot of fluid comes out. It's very characteristic, this particular condition. And this is a pulmonary adenocarcinoma. It's caused by an endogenous beta-retrovirus, and sheep have lots and lots of them in their DNA, maybe second only to mice, and they're just waiting to cause a number of problems. And one of the things that will happen is they will be turned on and they will grow these large pulmonary carcinomas. On cut section, they often look like lymphoma. Note that the rest of the lung is unaffected. The caudal lobe is unaffected. Your main differential in most of these cases is going to be answer C, ovine progressive pneumonia, which is caused by ovine lentivirus. But that's usually a diffuse interstitial pneumonia. The entire lung will be hyperinflated. That's a lymphocytic interstitial pneumonia. And the two can look fairly much alike, but when it bulges from the surface like this, the rest of the lung is not inflated. I think that that's pretty good. We also mentioned Answer B, pulmonary mulleriasis, the etiologic diagnosis for Mullerius capillaris. And that and Protostronzus rufescens are fairly common lungworms of sheep. And what those will do is they often track initially the large airways of the caudal lobes. And you'll see these raised greenish-gray granulomas. Sometimes they form little triangles at the caudal edge of the lobe. In severe infections, they will go down the entire lobe. Early infections usually track along the caudal lobes. They're discrete. You don't get this level of edema with them, but something to think about. Very common in small ruminants. And then the last one is mycoplasmal pneumonia. That would be a classic bronchopneumonia, primarily affecting the cranioventral lobes. They would be collapsed. Mycoplasma hits the airways. Mycoplasma are cell wall deficient gram-negative bacilli that live within the cilia, and most of the inflammation is around the airways. Mycoplasma pneumoniae can cause severe disease, but it's a classic bronchopneumonia. This one looks like a tumor to me. It looks like maybe a lymphoma, and when I see that, I'm always going to go with pulmonary adenocarcinoma and the Yagsikti beta retrovirus. Okay, let's move on to slide number 3. And this is tissue from a duck infected with H5N1 virus. The question is, what was the precipitating histologic lesion? Or what started this particular gross appearance off? Your choices are A, loss of corneal endothelium, B, anterior uveitis, C, rupture of Descemet's membrane, or D, a type 3 hypersensitivity to corneal stromal antigens. Well, hopefully you've been reading the journal Veterinary Pathology, and those of you who are studying for the ACVP exam, you better know this one. Because if you want to join the club, you got to know the magazine inside and out. Here at the JPC, our residents study that about 5 years back, and they go 3 years back with all the other journals. But VetPath is a very important journal. It is the journal of the ACVP, the ECVP, and the JCVP. So I think everybody should be very familiar. And this was a very good article. 2016, the first volume in January by Yamamoto et al. And the correct answer is A, loss of corneal endothelium. At 3 to 4 days post-infection, the authors were able to isolate the H5N1 antigen. Remember, H5N1 is a potent form of avian influenza, and HPAI is spread by waterfowl. They usually introduce it to other types of birds, like poultry and some exotic birds. Okay, so they found this at 3 to 4 days within the corneal endothelial cell. It's going to kill the corneal endothelium, it'll slough off. The findings of corneal edema that is seen in ducks have not been reported with any other virus. So this is sort of a classic lesion for this virus in young ducks. Your other choices, anterior uveitis, could be. Type 4 or type 3 hypersensitivity corneal stromal antigens. This was 3 to 4 days later, so it's very unlikely to be any type of hypersensitivity reaction. The title of the article is Corneal Opacity in Domestic Ducks Experimentally Infected with H5N1 Highly Pathogenic Avian Influenza Virus. Good gross lesion in an important article. Okay. Slide number 4 is, as you can see, tissue from a rat. I would like to know the cause of this lesion. Your choices are A, Citrobacter rodentium, B, intraperitoneal injection of chloral hydrate, C, Atresia ani, or D, rectal stricture? Choices again: Citrobacter rodentia, intraperitoneal injection of chloral hydrate, Atresia ani, or rectal stricture. Okay, time's up. This one's right off page 162, Percy and Barthold. It's on the reading list for the ACVP exam. It is a classic lesion. There are actually two different causes. One is intraperitoneal injection of a number of anesthetics. Chloral hydrate is the one I put in here. That would be the correct answer. Avertin is one that's used. You probably get from sodium pentobarbital. And absorption and irritation results in megaloileus. That is the term that is given for this. Just great, tremendous distension and lack of motility of the gut. Megaloileus. So it's intraperitoneal. Now, the other true cause of this, which wasn't on your list, so you couldn't have chosen it, is Lawsoniasis. Lawsonia intracellular can cause this, but usually and more commonly it's seen in animals that were anesthetized with IP injection of an anesthetic agent. Let's look at your foil, Citrobacter rodentia, that causes transmissible ileal hyperplasia in mice, and you can get a very large ileum. In a mouse, you can get rectal prolapse, anything that causes this type of distension could give you rectal prolapse. But Citrobacter rodentia used to be called Citrobacter freundii. I don't know why they changed the name of that one. But it'll cause a big piece of gut in a mouse, but it's not a problem in rats. Atresia ani, you can see in just about any species. I guess that potentially could cause this, but it's not as good as injectable anesthesia. And D, rectal stricture, I would think about that in pigs that are infected as young animals with Salmonella typhimurium, and that will cause rectal stricture due to poor healing at the junction in the rectum of the vascular fields of the cranial pudendal artery and the caudal hemorrhoidal artery. And there's this area of the rectum that just doesn't get fed a lot of blood, and so it tends to scar in. And the rectum you'll have a lot of collagen produced, and it'll stricture down the animal's canth. And they will get this really large gut, but that's a pig thing, not a rat thing. Okay, would you like to move on? Well, I guess if you don't, you can always turn your computer off, but I'm going to move on. And this is slide number 5. It is tissue from a horse. And the question for you is, what was the precipitating viral infection? And your choices are ECPV1. That stands for Equus caballus papillomavirus 1. Or ECPV2. Choice B is ECVB2. Choice C is ECPV3. And guess what choice 4 is? Or choice D? Well, I'm going to mix it up here. That's bovine papillomavirus 1. So your choices again. A, Equus caballus papillomavirus 1. B, Equus caballus papillomavirus 2. C, Equus caballus papillomavirus 3. Or D, bovine papillomavirus 1. Okay, time's up on this one. This is another, and it's a fairly important VetPath article which came out in 2015 by Jubb et al. The name of the virus gives you the answer. The name of the article gives you the answer, and the article is called Equine Genital Squamous Cell Carcinoma. In situ hybridization identifies a distinct subset containing Equus caballus papillomavirus 2. So if you wrote down B, you are correct. We see this in squamous cell carcinomas on the equine penis. Squamous cell carcinomas of the vulvar lips as well. Never forget the potential for malignant transformation of papillomavirus lesions to squamous cell carcinoma. The fourth choice, and I don't think it's a great question, you're just asking, do you remember, is it 1, 2, or 3? And the fourth question, bovine papillomavirus type 1. Remember that can cause sarcoids, but this is an ulcerated lesion on the penis. You can get sarcoids there, more likely to be squamous cell carcinoma, more common. And 3 or 4 choices were papillomavirus, so I would go with the one you know causes penile squamous cell carcinoma. Okay, slide number 6. Here's a great picture from Dr. Oscar Quesada from the Canary Islands. And this is tissue from a pig. What is the cause? Your choices are A, finely ground feed, B, endotoxemia, C, gastric volvulus, or D, ingestion of T2 toxin. Once again, tissue from a pig, A, finely ground feed, B, endotoxemia, C, gastric volvulus, or D, ingestion of T2 toxin. Okay, this is a great picture, a good question, I think, if I say so myself, and this is out of Jubb and Kennedy. It's page 51 of volume 2. And we're looking at a large gastric infarct. The correct answer for this is B, endotoxemia. You can see this with Salmonella cholerae suis or other gram-negative organisms. It's an infarct. There's overlying necrosis. There's been thrombosis of the vessels here in the stomach. I bet a lot of people said finely ground feed, but look at the pars esophageal right here. That looks beautiful. There's not a lot of hemorrhage in the stomach. We're not looking at a gastric ulcer. Now there's a little yellowing here. That just could be due to vomiting. It could be some of this. But and you do see some yellowing around the pars esophageal, which represents hyperkeratosis in the very early stages before you get to the ulceration. That's a good looking pars esophageal to me. Your choice C was gastric volvulus. I don't know if that's a pig thing. Certainly it's a dog thing, and it's a guinea pig thing. Okay, guinea pigs actually, it's more gastric stasis, and they'll get, their stomachs will absolutely blow up. It looks like it's twisted, but there's no twist to it. It's not a pig thing. And then D, ingestion of T2 toxin. You can get some ulcers, especially in the mouth, in animals ingesting. That's called vomitoxin. They don't like the taste. They won't eat it unless they're absolutely forced to. And you can get some gastric ulcers, but you don't get this big infarct. So it's a great gastric infarct, and you want to think about endotoxemia in pigs with gastric infarcts. Okay, we're getting closer to the end now. We've only got 4 left. I am going to give you a slow pitch if you're up to date with Jubb and Kennedy. And here we go. It's tissue from a dog. What's the cell of origin for this tumor? Your choices are A, Schwann cells, B, T cells, C, B cells, and D, histiocytes. Once again, A, Schwann cell, B, T cell, C, B cell, D, histiocyte. Okay, you can look this one up if you want. It's on volume 3, pages 448 and 449 of Jubb and Kennedy, almost at the end of the book. The diagnosis for this, which I didn't ask for, is a transmissible venereal tumor. Looking at the penis of the dog, the penis, the tumor involves the glands, the shaft of the penis, and the inside of the prepuce as well. These arise from histiocytes. Okay, they don't have the proper number of chromosomes. They only have 59 chromosomes. They start out, they don't express major histocompatibility antigens, which allow them to be xenotransplanted. They're one of the very few tumors that can be transplanted between susceptible individuals. Eventually, over several months, they will start to elaborate MHC2 antigens, and the body's going to take care of it. In the vast majority of cases, maybe some animals with some type of immunosuppression, they can go all over the place. They can metastasize along the skin, they can metastasize internally, but the vast majority of animals, they eventually take care of the infection. Your other choices were A, Schwann cell tumors. Schwann cell tumors are interesting. They give rise to a number of other tumors, including granular cell tumors of the equine airways. They're considered to be the cell of origin for the facial tumor of Tasmanian devils, and maybe some granular cell tumors in other species, but not this one. B cell and T cell and B cell. Questions B and T, that would be that you thought this was lymphoma. Yeah, no, I don't think that you're going to go with lymphoma on this one. So, sort of aberrant histiocytes of the cell of origin. Okay. Question number 8. This is tissue from a goat. Which of the following would be a diagnostic histologic finding in the brain of this animal? Okay, which of the following 4 choices would be a diagnostic histologic finding in the brain of this animal, which clue you into what disease you're looking at? A, microabscesses in the brainstem. B, periventricular vascular fibrinoid necrosis. C, ring hemorrhages in the thalamus. Or D, intramural vascular edema. Okay, this one makes you think, and you have to be up to date with reading veterinary pathology. This was an electronic publication from January 20th from my good friend, Dr. Paco Uzal, and I'm lucky because he came to the JPC and gave a great lecture on clostridial diseases. If he's ever in the neighborhood, or you can travel to see him, go see him. He is the godfather of clostridial disease. He does all great work out at the California Animal Health and Food Safety Laboratory in San Bernardino, California. The article was published by J. Ortega et al., and Paco is in there somewhere. The answer straight out of the title of this article: the intramural vascular edema in the brain of goats with Clostridium perfringens type D enterotoxemia. So, back up a little bit. Enterotoxemia is a classic disease of sheep and to a lesser extent goats, which causes hemorrhages throughout the body, especially bilaterally in the brain. It's called focal symmetrical encephalomalacia. And you will see hemorrhages. It's due to the epsilon toxin. Initially causes ulceration in the gut. The ulceration allows the epsilon toxin to get into the bloodstream. It goes to a number of places. You can see hemorrhages throughout the body, just about anywhere. There are some classic areas, as in the brain. And it's a very interesting lesion. The vessels of the brain have intramural edema. That's not edema around the outside of the vessel. We see that with a lot of different diseases, but it's edema actually within the walls of those vessels in the brain. You won't mistake it for anything else if you start looking for it. Okay, so the correct answer was D, intramural vascular edema. If we look at the other foils, A, microabscesses in the brainstem, that's listeriosis. We see listeria in sheep that graze on improperly fermented silage, which doesn't get acidic enough and allows listeria to overgrow. In goats, they don't eat silage. They eat just about anything they can find, so we're not exactly sure where the listeria comes from in goats. B, periventricular vascular fibrinoid necrosis. That is FIP in cats. Okay, it's not just fibrinoid necrosis. There's a lot of inflammation, but periventricular vascular degeneration, I just pulled that straight out of FIP. Ring hemorrhages in the thalamus. You can see that with a number of conditions. Cerebrovascular accidents in dogs, you can get that in the thalamus. You can see that with central venous thrombosis in macaques and people. Nothing specific. So what you're looking for is that intramural vascular edema. Great EPUB. It might be out in print by now. Ortega et al. We only have 2 more questions here. Here's a fantastic image by Dr. Don Mutin. And this is tissue from a dog. This is tissue from a dog the tissue has been treated with potassium dichromate. The dog wasn't treated. This particular tissue is treated with potassium dichromate. That's a bit of a hint. Okay, which of the following markers has been identified as associated with decreased survival in dogs with this particular condition? Okay, let me go over that again. This tissue from a dog, and this tissue has been treated with potassium dichromate. And which of the following markers has been identified as associated with decreased survival in dogs with this condition? A, chromogranin A. B, P53. C, S100. Or D, none. No immunohistochemical markers were considered significant in terms of survival time. Well, that's a long question. That's why I like the short answers. Morphologic diagnosis, etiologic diagnosis, and cause. The test is changing. Trying to change a little bit, not too much along with it. Okay, time's up. Once again, from Veterinary Pathology, another EPUB from Zini et al. The name of the article is Pheochromocytoma in dogs undergoing adrenalectomy. Remember, pheos, if you put potassium dichromate, they turn a reddish-brown color. Normally, they would be sort of clear. They would have hemorrhage within them. Tough to tell because somebody got out the potassium dichromate and stained it. So adrenocortical neoplasms will not stain for that. So this is sort of a 2-pronged question. The correct answer is D. No immunohistochemical markers were considered significant in terms of survival time in animals with pheochromocytomas that underwent adrenalectomy. Doesn't matter what the other 3 foils, nothing predicted survival time. Okay, finally, question number 10. This is tissue from a horse. Which of the following 4 choices has shown to be diagnostic for this condition? A, cytology of the cranial cervical ganglion. B, PCR, polymerase chain reaction, of the hair follicles. C, immune fluorescent of conjunctival scrapings, IFA of conjunctival scrapings. Or D, PCR on the feces. Once again, this is tissue from a horse. Which of the following is shown to be diagnostic for this condition? Okay, time's up. Well, to know which is going to be diagnostic, you got to know what the condition is. Okay, these are some of the lesions that you will see with equine dysautonomia. It is a disease that affects the motility of the gut. We have coalescing esophageal ulcers as a result, likely, of regurgitation, or at least paralysis of the gastroesophageal junction and reflux. Not really regurgitation. Horses can't regurgitate, but it's reflux. That was the word I was looking for. Gastric reflux. And down here, we have a bunch of hard feces, fecal balls in the colon, which haven't been passed because this animal has dysautonomia. Okay, once again, VetPath, straight out of VetPath, 2019. It's in the title. The article's by, hope I get this right, Piccinelli, Piccinelli et al. And the title of the article is Ganglion Cytology, a novel, rapid method for the diagnosis of equine dysautonomia. Okay, Volume 2, 2019. Your foils for this. So A, cytology of the cranial cervical ganglion is number one. And if you look at ganglion cells, you're going to see sort of a central chromatolysis. So if you get a ganglion histologically, you get one when you're sampling the gut, look for significant changes, even in the ganglia and the neurons of various parts of the equine GI tract. You're going to look for changes there. Cells should be swollen. Nissl substance should be very difficult to find. It's sort of a big pink cells. So your other foils on this one, B, PCR of hair follicles. Not sure what you would do with that. I sort of made that one up. Makes me think of, I don't know, circovirus. There's an equine circovirus. I mean, there's a canine circovirus. Circoviruses certainly get into feather follicles. Maybe does in the dog. I don't know. I just made that up. IFA of conjunctival scrapings. Maybe I would do that for chlamydia. That would be a good one. And then fecal PCR. Fecal PCR is all the rage in laboratory animal colonies for a number of agents, but never heard of anyone doing. I guess you could. You could do fecal PCR on maybe a foal with Lawsonia. I know they certainly do it on rodents with Lawsonia, so I don't see why you couldn't. It'd probably be fairly non-specific. But what you're looking for here is cytology or histology of the cranial cervical ganglion. Okay, well, that's it for today. We had a bunch of great questions out of articles within the last 4 years of VetPath. We had some good ones out of Jubb and Kennedy. I hope you enjoyed this particular Growth Path Challenge. I'll be back in a couple of weeks with some more. I'm going to do a little bit of traveling, some lecturing, and I'm going to get back and put some more lectures and Growth Path Challenges up. This is the last one for a couple of weeks for me. I hope you had a good time. I wish you, until the next time I come to you with one of these lectures, great health and a fantastic couple of weeks. Take care, everyone.